So now we're in your clinic. A patient has gone unresponsive on you and you are now acting as a first aider. You and your team has lowered the patient onto the floor. Someone is starting compressions and breaths using your clinic's practices and procedures. Someone has gone to call 911. Someone else has gone to get you an AED and your first aid kit. That AED has just arrived, and we are going to start using it on the person. So right off the bat, we're going to open it up and turn it on and start following all the prompts that it gives us.
Begin by removing all clothing from the patient's chest. Cut clothing if needed. When patient's chest is bare, remove protected cover and take out white adhesive. Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. No one should touch the patient.
I'm clear, you're clear, we're all clear.
No one should touch the patient. Analyzing. Shock advised. Stay clear of patient.
There's our
Press
flashing
the
orange shock button.
orange button now.
Gonna press it. Make sure no one's touching the
Delivered,
patient.
shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR,
So here's
press
our
the
blue
flashing
information
blue
button. I'm gonna press that button and we're gonna follow the prompts.
Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Stop CPR. No one should touch the patient.
I'm clear, you're clear, we're all
Analyzing.
clear.
No one should touch the patient. Shock not advised. It is safe to touch the patient. If needed, begin CPR. For help with CPR.
So at that point, the AED has found or doesn't have a shockable rhythm with this patient, so it's not going to deliver any shocks. If the person is now responsive or is breathing, you don't need to continue CPR. If they're still unresponsive and still not breathing, continue CPR until advanced care arrives. So that's it for our demonstration of our on-site AED. Thanks for dropping by our booth, and I hope you guys enjoy the rest of the trade show.